Hi, my name is Madison, and I'm going to demonstrate how to do a subcutaneous insulin injection. So first we're going to gather our supplies. We're going to use a 100 unit insulin syringe. We're going to have our vial of insulin, gauze, alcohol pad, gloves. So first we're going to establish the 6 rights of 6 rights of medication administration. So we're going to make sure we have the right patient, the right medication, the right dose, the right route, the right time, and the right documentation. So first we're going to check our MAR to check our doctor's orders on what kind of insulin and dosing, if they have a sliding scale, that kind of thing. So first we're going to do that. We're going to grab our correct insulin. We're going to check to see if there's any cracks, anything like that. We're going to check to see if the vial was already opened. If it isn't, and we're using a multi-use, then we are going to label it accordingly with the date that it was opened and the time and my initials. They are only good for 30 days after it is opened. So first, we're going to clean the top of our, we're first gonna rotate it in our hands. We don't shake it, and up to a minute. So now we're going to clean the top part of our syringe, and then we are going to inject the amount of air. So in this case, we're going to say 20 units. And then we're going to uncap and place it onto a clean surface. We're going to inject the amount of air into our vial, and then we are going to flip it over, and we are going to inject the amount of insulin, tapping out any air bubbles. Okay, so we are going to take our needle out. We're going to cap it with our one-handed technique, and then we're going to have a second nurse verify our dose to make sure that it is drawn enough, or that our dose is correct. So now that we had double checked, we're going to go into our patient's room. We are going to have our patient get identified with 2 identifiers, full name and birth date. We are going to explain the procedure. We're going to explain the medication, and then we're going to select a site. So normally we get, best one would be the abdomen. So we're going to have them lay supine, and we're going to have them just hold up their shirts so that we could access the site. So we're going to do hand hygiene and put on our gloves. Okay. Now we're going to clean our site with an alcohol prep pad in circular motions, allowing the time to dry. Okay. So now we're going to uncap. We're going to have our bevel up, and we're going to hold it between our pointer and index and thumb fingers. We're going to pinch our skin, and we're going to either inject from a 45 to a 90 degree depending on the patient's size. So right now we're going to inject at a 90 degree. So we're going to pinch our skin and we're going to inject at a 90 degree. And then we're going to slowly inject the medication, stabilizing the syringe with our non-dominant hand. Okay, we slowly injected it. We're going to remove, and we're going to discard our needle into the sharps container, and we're going to dab it with gauze. We won't massage it or rub so that we don't irritate anything or have the medication move in the areas that it doesn't need to be. So now we're going to put our patient back into a comfortable position, make sure that they have their call light, all the fun safety stuff, and then we are going to take off of our gloves, and then we're going to document in the MAR the dosage and the site that was used. Okay.